Well, the Supreme Court is expected to make a decision tomorrow on a healthcare bill that has been a topic of controversy for the past 2 years. The Affordable Care Act, commonly known as Obamacare, was originally passed in March 2010. Lacey Monteleone is live in the studio with more on what the outcomes of the decision can mean. Lacey, what did you learn?
Well, Dennis, the Supreme Court decision can go many different ways tomorrow. It could be upheld, struck down in full, or something in between. The Affordable Care Act provides new coverage for 32 million Americans, and for Lawrence Massa, president of the Minnesota Hospital Association, that can only be a good thing.
There's a number of other provisions to the bill that are very important in terms of eliminating pre-existing condition requirements. Lifetime caps are eliminated with the law. So it really does provide a much more accessible insurance coverage for many more Americans.
The individual mandate, which would require those without health insurance to purchase health insurance, has become the sticking point.
The federal government is going to come in and say that you have to buy something. That's a little bit ridiculous.
You need to have a risk pool that has healthy people as well as sick people in it in order for the cost to be spread. If there's no mandate, healthy people won't buy insurance until they're sick.
Massa says that people may not be as well informed about the act as they could be.
There's been a lot of debate in the media about the selling of the act and explaining it to the public, and whether the administration's done a good job with that, whether the opponents perhaps have done a better job of tearing down certain provisions without really addressing some of the other positives that people like.
According to a Reuters poll released this week, over half of all Republicans disagree with the Affordable Care Act. But if you take out some provisions of the Affordable Care Act, 78% of Republicans support banning insurance companies from denying coverage to those with pre-existing conditions. And 52% support allowing children to stay on their parents' insurance until they're 26. But Carlson says that you can reach those same goals without having the Affordable Care Act.
Rather, we should put that into the hands of the consumer, have consumers have health savings account plans that they can build and save for high deductibles.
Both Massa and Carlson agree that the Supreme Court decision tomorrow will probably strike down only parts of the bill, but they disagree on what they would like the outcome to be.
My guess is that at minimum they will strike down the individual mandate. I can't imagine in my wildest imaginations how that could be constitutional.
If the Supreme Court strikes it down, we're back at that dilemma of how do we provide coverage for all of these uninsured Americans.
Now, Carlson says that if the law is not overturned tomorrow and Mitt Romney was to win the election this fall, that Romney would overturn the legislation. But Carlson says he does not expect the outcome tomorrow to have any long-term impact on the November election. Dennis, back to you.
Okay, thank you, Lacey, for the live report tonight. Before the Supreme Court ruling, 4 federal appeals courts heard challenges to the law. Those cases resulted in 3 different outcomes.
If you've enjoyed this segment of Lakeland News, please consider making a tax-deductible contribution to Lakeland Public Television.